Welcome back to the Trinity Chiropractic Patient Resource Library. Today's topic is the lower back, and for many of you, this is the one that you're waiting for. The reason for that is 75% of the population encounters serious low back disability at some point in their life. And at any given time during the year, 25 to 30% of the population have lower back pain to a significant amount. The statistics are staggering. It's our second most costly healthcare expenditure in terms of time lost from work, time from disability, wasted resources, and then how people are affected throughout the course of their lifetime. Most people who do have that one episode of lower back pain, 85%, end up having recurrent episodes. So when we look at the stats, when you do have lower back pain, it doesn't just simply come and go away on its own. It will recur over the course of your lifetime. But there's good news, and that's what we're going to talk about today. We're going to give you some background into why you're getting lower back pain. In our next part of the series, part 2, we're going to talk about the specific strategies that you can do, the hands-on things that you're going to be able to do for yourself for it. But to better understand it, we have to dive into a little bit more about the lower back, the history of its treatment and how it's been mismanaged over time, and understanding some of the structures involved as well as to why you have pain as you do. So first off, with the lower back, it has been mismanaged over the course of the last 50, 100 years with our modern medical approach, because most people, when they've had back pain in the past, have been told to get bed rest, rest it up for a period of 4 to 6 weeks, and then slowly increase activity and take narcotic medication to minimize the pain. And both have been flatly shown to be ineffective. In fact, they make the problems worse. So we've gone from a structural approach in the past of managing it with rest, looking for a diagnosis on an x-ray, and x-rays are not there to identify why you have pain. They might identify some pathologies, but they're not of any value for most people with their day-to-day back pain. And this is only information that we found out in the last 10, 15 years that has directed us towards what's termed a functional approach for your lower back. One of the reasons you have lower back pain to begin with is your lower back has two important functions, and they're both opposite each other. One of the functions of your lower back is to give your body stability and strength. The other one is to give your body mobility. So when you have strength and mobility as the main systems of your back, you are going to encounter a problem. They're conflicting with each other. So the lower back is comprised of 5 vertebrae. We call them the lumbar vertebrae. They don't have ribs attached to them like the thoracic spine. These are the purple ones that you see on the model. We're going to talk about the sacroiliacs in another episode. Those are the joints that form between the sacrum, which is your tailbone, and the hip bone. So that'll be another time that we'll be talking about those joints, which account for a lot of people's pain in the lower back region, but it's separate from the lower back joints. So it's important to keep your back in a stable, strong, neutral posture throughout the daytime during those activities of repetitively doing something in that seated or standing position. Your back has a lower back curve to it, an upper back curve called the kyphosis, and a neck curve as well too. The lower back curve is designed to keep your joints and your nerves and your muscles in a position that doesn't create undue stress on those areas. When there's more stress on them, they break down very slowly over time. So that's why a lot of people come in as a result of a problem that's been developing over sometimes 5, 10, 20 plus years before they develop acute pain. The chronic stresses of your posture on a day-to-day basis are what are creating problems in your spine because it's taken out of that stable position. On the mobility side of things, as your back is designed to give you mobility so that you can play sports and engage in activities and do the things that you like to do, when the motion patterns of your spine are damaged or go off track, then you're going to be creating stress on some of the tissues that surround your back, the nerves, the ligaments, the tendons, the cartilage, etc. So those areas are designed to give mobility and flexibility, and they need to work as a system to protect your back from injury. So first we're going to jump into stability, which is something that a lot of people ask about when they come to the office. Everybody has heard the term stability exercises. Stability simply means the ability to keep your back in a fixed, strong position well, there's stressors around your back trying to create instability. You guessed it. So stability is important for your back because most of the day we're doing things in a static posture. Think of sitting down for a long period of time or standing for a long period of time, maybe at a counter, maybe you're at a desk. So both of these areas are the reason why people will come into a chiropractic office. Something has injured their back to create an episode of pain. And when we've identified areas of a lack of mobility or stability being involved, that's where chiropractic lends itself to correcting that, to alleviating pressure on the nerves. But there are many things that you can do to help out with your chiropractic adjustments. And that's what we're going to be talking about next time. So stay tuned for our next video where we're going to get into the strategies that you can do to help protect your back and create it stronger for a lifetime.